everyone. I hope you all had a great weekend. We are back with another Revolution Round Town, and I am joined by three truly amazing women that are making an impact in our community on an everyday basis, and they're so behind the scenes that no one even probably knows about it. But these ladies work at the Rape Crisis Center, and we are here to talk about that this is Sexual Assault Awareness Month, and it's a national month that they are going to be doing, raising a lot of awareness and helping victims find resources that they need and helping all women of our area have resources that they need to prevent. So I wanted to say thank you for bringing us in and helping you guys spread the word about this. But Ms. Bev, I'm going to kind of defer to you first to kind of just give us an overall awareness or overall kind of high level who the Rape Crisis Center is.
Well, Stephanie, first of all, I want to say thank you for doing this for us. We are elated to have you take the time out of your busy day to come and, help us highlight what we're doing in the community. But the Rape Crisis Center is a crisis intervention center. We've been in existence for over 30 years, and we provide services to individuals who are victims of sexual assault, childhood molestation, and we even work with individuals who are survivors of human trafficking. So we do it all. Yeah, we do it all.
Yeah, these are true victims that have been taken advantage of, and you guys step in and just give them that like, we're going to take care of you, and they feel like they're supported.
Absolutely. But one of the things that we want to share with you is after they have come through our program, we no longer want to call them victims.
Right.
We want to make sure that they know that they are survivors, because they can't survive the horrendous troubles that they have endured all their lives, and we want to make sure that we provide them what they need to be whole again, to walk through this journey and become a survivor rather than a victim.
Yeah, for sure. All right, well, Erin, I wanted to ask you tell me, kind of just run through what happens. So if you are a victim of a rape or sexual molestation or something, and you go to the hospital, because that's typically what happens from there?
So the hospital reaches out to us, or law enforcement. They will reach out to us, and one of our volunteers, one of our advocates, will go directly to the hospital. We take clothing, which is one of the things this drive is for, is to get clothing for our agency. We take them clothing. Their clothing is taken as evidence typically, and we will sit with them. We will stay with them. We'll help them through what is really a traumatic event. Not just the assault, but having to go through the rape kit and through the interviews with law enforcement.
Almost reliving.
Yes,
the situation.
absolutely. And so we will have an advocate there with them. They can then sort of get to know what is available to them with counseling through our agency. We will sort of introduce them to the agency. We will let them know what's available to them medically in the community, what sort of things are available to them overall, from this point forward, because this is really a new reality for them.
Oh yeah.
There's definitely a before and after a sexual assault. And so we don't stop there though. We follow up with them the next day, and we continue to follow up with them. We go with them to their hearings. We offer them counseling. If they need legal help, we help them with that. And we look at it really in a holistic sort of a way. They can't concentrate on getting better if they're worried about their rent, if they're worried about, all of these other difficulties they're going through. And so we work on all of that. We look at them as a person. So we really offer a lot of services for our community.
I mean, way more than I even knew. So I mean, I always say, I love doing these type of interviews because I learned so much about, all the different groups that we have in our community that are really working so hard to help everyone in our community that you don't always think about. And sometimes this is not a topic that is glamorous and fun, and people want to be a part of the fundraising for and all of that. And this is what really needs to happen. It's not. Yeah, you're right. It's not the most comfortable of conversations.
I do want to say, though, that it isn't just when they go to the hospital.
Right.
We also have our crisis line that is 24 hours.
Okay.
And we get a lot of calls from people who have been triggered, from an assault that's happened at a different time. So we also offer counseling to them. There are victims, secondary victims, people, family members, who maybe your child or your spouse was assaulted and and you need to know how to help this person.
Yeah.
You know, that's huge, how to best support this person.
Yeah.
And we also offer counseling and help for those people as well.
Can I interject something there? Would you share with them while we're talking about this, the resources, how if we have somebody who is a victim of a high-risk assault, we also partner with a care team that is an HIV/AIDS service organization, but not only do they provide services to individuals who are victims of rape, but they provide the medications, and we partner with them to make sure that that medication is at no cost to them. They do case management, and they do a 3-month, a 6-month, a 9-month, and 12-month follow-up. So it's so important for somebody who has to be prescribed with HIV prophylaxis medication. So that's another thing that we're very proud that we're able to provide for individuals who are victims of high-risk assaults.
Yeah.
And our agency, you know, in addition to helping victims at the time of their assault or in counseling or working with them after the assault, of course, Tamara and Bev both. Tamara works in prevention and Bev works in community outreach. It's so important to teach our community and educate our community on not just how to prevent sexual assault. And we're not talking about the victims preventing sexual assault.
Right.
We're talking about our community.
Yes.
How in our community
Yes.
can we help prevent sexual assault?
Yeah.
Teaching, you know, our community how to see something, you know, and say something. How to prevent those things. And Bev teaching our community about how, you know, they can better work with everyone. Bev, that's really yours.
Yeah.
Well, that's
you.
true. That's true. One of the things that I like to tell folks that we partner with other agencies because they have individuals who are within their scope, and they have individuals who may be victims of sexual violence, and they need to know their directors or their employees, period, need to know that these services exist.
Yeah.
And so if they know how, and sometimes I'll use this as an example. For somebody who doesn't know where to go and they don't know what to say, they can always say, you know what, I know somebody at Rape Crisis Center, and they'll get you through this. And that's what we'd like for the community to know.
Yeah,
that we are
the
here.
right people to call to get the
Absolutely.
answers and the help that they need.
That's right.
That's all, you know, it's a big part of it is that, you know, you have this happen, or you have someone that you know have it happen, or you saw something happen, you're just like, who do I call to help this? And it's not always, you know, you try to call 911, you're not sure, is this gonna really get through, you know, to be able to call a resource like y'all, to be able to really get the help that, you know, the victims need, or, you know, to kind of start in there.
One of the things that I always want everyone to know is, you know, sexual violence is a violent crime, and it's no fault of that individual who has been victimized. And so try not to ask the why questions, because why indicates that it's your fault or that you had something to do with it. Don't ask what were you wearing, you know, what did you have to drink, you know, and things of those natures. Because one of the things that we found out is, you know, the perpetrator does not change, you know, their behavior. They just change the person in which they perpetrate on. And so if they find one thing that works for them, they use that over and over again, because that's one of the reasons why we know now that a perpetrator will victimize at least 11 times before they're caught. And
that's so scary.
Yeah. And thankfully, you know, because of DNA not lying at all, you know, those a lot of people are being brought to justice for that. Not enough,
right?
But, you know, justice is being served.
For sure, like if this happens to you, it's not something to be embarrassed by. I mean, obviously, you just said it's not your fault. This is something, you know, you get to the people that need to help you get to the hospital as soon as you can, so they can collect all that evidence and stop someone like this, because you could be the first and stop it from happening from another, you know, 11 individuals.
Yes. And another thing I want to share while we're on that subject is, you know, there is a law that allows an individual who's a victim of sexual assault, it allows them to go to emergency, get the medical attention that they need without having to call law enforcement.
Okay.
That's called anonymous reporting. Anonymous report. You have to be 16. Excuse me. You have to be 18 to do that. But that individual needs to know that medical attention is out there for them.
Yes.
And they don't have to get law enforcement involved immediately if they don't want to, but they have up to 1 year to report if they choose. And that's something that, you know, I teach in individual groups.
Yeah.
You know, it's worth you know, mentioning on this show.
you know, I'd like to break another misconception. A lot of people watch, you know, SVU, a lot of crime
Yeah.
shows, and there's this idea that if you've taken a shower, if you've gone to the bathroom, if you've changed your clothes, that you're out. You can't press charges. You can't do this. You can't do that. That is absolutely not true. You have 120 hours.
Wow.
120 hours beyond the assault that evidence can be collected.
Holy moly.
Even if you've taken a shower, even if you've gone to the bathroom, even if you've changed clothes. So please don't think that you are beyond that window, because I know that, you know, it takes a sleep cycle for some things to really settle in,
Yes.
and you're terrified and you don't know what to do, and you go home and you think, well, I can't do anything now.
Yeah.
You know, I should have, could have, would have done this or that, and that's not true.
Yeah.
You have 120 hours. Please
That's
go.
so important. Because, I mean, I do watch a lot of cop shows. My husband, he's always like, "How are you watching?" But, I mean, they need to put that
They
out
do.
there. I was
They
like,
do.
they're going to
There
rewrite that
is.
into the script, because that is, like, incredible information that people don't know.
They don't.
And I'm glad Erin said that, because it's not, you know, it's a process.
Yeah.
Even when they go and they report, it is a process. Like we sometimes get calls and want to know, you know, law enforcement isn't doing anything. What's going on? And that's one of the reasons why if they come into our counseling care, you know, we can keep them grounded and remind them that, you know, yes, there's something going on behind the scenes.
Right.
But it's not like on TV.
No.
They
It's
don't
not.
run
It
out.
doesn't
No.
happen.
Yeah,
They don't run out and make an arrest.
Yeah.
There's a lot
Yeah.
that goes on.
Right. A lot of the background.
Yeah.
This is amazing. And so this is why this month is so important.
Yes.
To
Absolutely.
really spread all of this information and get the proper information out to people and the truth about what is really going on. So we have a lot of events all month. I mean, there's a list of events like this long, which is amazing. That we're going to link to a lot of it all on our social media, and we're going to have a part in doing some of the events that they have coming up. But Tamara, we're not going to leave you out there on the end. I know you want to just come and be supportive. But why don't you talk about a few things that are coming up, because it's not just supporting. You know, any woman can come and get some of the prevention.
Right. That's what we're understanding. Is it's not just about after the fact,
Right.
but there are things that we can do to prevent somebody from being a victim, and that's where the community effort comes in, but also the individual effort, and that's kind of my role here. And so this month is a good. There's a few events that we have that do provide things that we need for the Rape Crisis Center, but also can help you from even becoming a victim. For
Right.
instance, on April 9th, we have a self-defense class coming up virtually, and that's an idea of how preventing a woman who hasn't been a victim yet but wants to know more about what she can do for herself individually. And we also have some podcasts coming up, one in particular that's going to talk about sexual violence and assault, so there we can have a dialogue there. But that's my role, is also to do the prevention piece, but also to incorporate and look at risk factors for perpetrators.
Right.
What community organizers, like Bev was talking about, can do for especially young people, young men and women who might be in that risk category, or just to kind of change the idea of social norms or the way that we look at women and violence and that kind of thing. And in fact, at Coastal Carolina, we're partnering with them with a dialogue. I can't remember the name of the title, but it's on our event page. But it talks about, you know, what you can do, and it's specifically tailored toward men on changing their idea about women and violence and the way that you should treat a woman or whatnot. But of course, it's going to be inclusive, and it will touch on several different topics.
Right.
But that's an idea. So not only the individual preventative measures, but also the education for potential victims and also potential perpetrators that hit the risk factors.
You touched on that. For me, it's always, I love that when people reach out and this is not just a woman issue.
I know.
And you know, when you help educate the entire community, including, you know, men and women together, to have that open conversation about it, on how you can prevent in any manner, you know, how you change your thoughts, how you know, can see something, you know, that could possibly help or happening and help it out. And it's not just, you know, a girl at a bar that's, you know, not, you know, dressed appropriately or drank too much. Like, this is not what this is about. Like, and it happens all the time, and it's not just in those situations.
Right.
And as Erin said, as Tamara said a few minutes ago, we want to get these men involved.
Yes.
And it's called The Mask You Live In. And
Okay.
it's a panel that's going to take place over at Coastal Carolina University. And guess what? It's going to be all men.
Yeah.
So let's tune in. The date will follow. It's going to be on April the 12th.
Okay.
But everything, all the dates and whatnot will.
Yeah.
Yeah,
time
if they
will be
follow our
posted.
Facebook page, you'll get notifications. There's some events that are already posted, and probably by the end of the week, we'll have all the events and times
Yeah.
posted. But if they follow us, they'll get notifications.
Yeah, that's great. I mean, the sexual assault or the self-defense class. I didn't even when you touched on that quickly, but I don't know if everyone heard it, but it's virtual.
Yeah.
So
Yes.
anyone, anywhere
Yeah.
can do
Yeah.
this. So you have families somewhere else. You have sisters. I mean, this would be a great thing. Me and my sisters get on all together.
Right.
We're on the. It's good for everybody, and you can.
If you have a daughter, I have two
Yeah,
college
daughters,
age
college.
daughters as well. You
Mhm.
know that it's important for them as well.
Yeah. And then real quick, we'll touch on, and I'm going to go out there and try to raise some awareness as well, but this weekend, they're doing a drive at multiple Walmarts in the area.
Yes.
So if we want to touch on that, because what it is they're looking for new items. So if you're going shopping, for your weekly groceries or whatever next Saturday, you can walk into Walmart, throw a couple items back into your cart, pay for them, walk back out, and they'll have ladies there from the Junior League that they have partnered with, which is another community group that is helping spread awareness for you guys.
They said
So-
they said they got us covered.
Right.
The event
They're
is called
good.
We've Got You Covered.
Yeah.
We are looking for t-shirts, shorts, underwear, bras, sweatpants, long sleeve shirts, anything. These are all new products that we take to the hospital to give to victims because their clothing is taken
Right.
as evidence. So
Yeah.
we take a little package to each victim at the hospital,
And-
that includes clothing that
With-
they can change out to.
Yeah, with Walmart's affordable prices, I
Yes.
mean, you can go in there and say, all right, I'm going to grab a t-shirt, a pair of sweatpants, a bra and underwear, and I mean, you're really going to spend probably maybe $25.
You got it. And
Maybe.
you'll have
Yeah.
one person.
And
at
you'll
least
have
covered.
one person covered, and
That's
you
right.
can know that you drop that off and you are doing your part, a very small part. There's nothing out of your routine that you have to do. It's just right there easy for you guys, made it very easy to, to be able to help.
And the list is also posted on our
Okay.
site. So if somebody wants to take a screenshot before they go to Walmart, just so they don't forget, it's there.
And as always, we're going to make sure I'll write up some stuff and we'll link to their Facebook page so that you can find all the information about everything that's coming up
And the location.
and the locations and everything. I mean, you guys have so many resources on there. I mean, I was just looking at some of the information here, but they are the Rape Crisis Center for Horry and Georgetown counties. So you can go on if you're looking right now and find their Facebook page, but we'll definitely link to it. And we'll kind of wrap up, and if you have just
I
got a
do.
few more items
I
that you
do.
want to
I
kind of go
want
over.
to. I want to share that Krabby Jack's at Barefoot Landing
Okay.
down in Murrells Inlet and at Broadway at the beach. They're also taking a part of this event. So all of those places are listed on our website as well.
So
Are
just
they
doing
accepting
kind of like a
donations or?
We're accepting donations.
Donations.
We just want people to give and feel good about
Yeah.
giving back to this
Mhm.
cause. Yeah.
And everybody in our community can use this information. Whether you've been, a survivor, you are a victim, you're a family member, or you just want to give yourself the tools to make sure that you can be aware, there's something that you guys can all do.
And we are always looking for volunteers to take crisis calls. This is something, we do train our volunteers. We don't just put you out there and ask you to
No.
talk to these truly traumatized women and men, but we do put you through some pretty extensive training. However, this is something that, especially in this time, you can do remotely.
Right, that's what I was gonna say.
You can take calls at home, and we are definitely looking for volunteers. You can go to our website, which is victimtosurvivor.org, and click on the link for volunteer and put in your application. And we are definitely looking for volunteers. I would appreciate anybody coming
Yeah.
to volunteer for us.
I mean, guys, it's a no-brainer. Just do your part. We will be so excited. But I want to share one other thing. We're having a virtual health fair that's also going to take place, and that's going to be on the 17th from 11 until 1. And we have lots of stuff going on there. And I will be one of the guest speakers talking about, the services that we offer and why it's important, because one of the things that we found out is, sexual assault that's unhinged can definitely be a public health issue. It's a public health matter. And so public health and this health fair is going to help expose a lot of that as well.
Yeah.
Thank you. so
Overall
much.
health total.
Yeah.
Yes.
You ladies are amazing. Thank you so much for what you do. You get in there and you really truly help the vulnerable in our area right now, and just do it with such grace and help them out where they're, you know, as kind of in the lowest point, I would think, like in your feeling, which is so sad, you know, and not knowing where to go and what to do and how to do it. You offer them the resources and the shoulder that they need when they need it the most. So we appreciate everything that you do. Make sure that you guys check out their page, join, volunteer, do your part this month, especially, and all throughout the year. So this is another Revolution Around Town with the ladies from the Rape Crisis Center, and we will be talking to you soon about a little bit more about what they got going on. Have a great day.
Thank you.